Well, and I think what happens is there's a lot of employers, and I've said this before, that they had an experience a number of years ago and it didn't go so well, not with what we're doing, but with another carrier. And inevitably they had headaches with the formulary or something, and it hit the C-suite, and there's just so much fear out there. And then we also have to fight the fight out there with folks in our community that they don't want to put the work in to do this. This is not for the faint of heart. This is a highly engineered program that we're getting better at and better at and better at. And then over the last 5 years, we've seen an immense evolution. I just think it's stunning. You have a manufacturer that if they literally lose a part on the floor in their CNC machinery, they lose money, and yet they're willing to just write this endless check every year for 4, 5, 6, 7%. And I'm not an accountant, but I think if you take $1 and take it times 0.07 in 12 years, it's $2, according to my calculations. And so it's just getting past this fear factor. It's been difficult, and you got to have accountability, and accountability is going to have to be with that broker. We're educators, but we're also going to be there to make sure that we're going to solve the problems as they arise, because it's not a perfect world. And even the BUCA world that they've existed in, it's far from perfect. They've made it look like it's just going to be a smooth ride, but just getting past this fear on all angles is, I don't know, do I say frustrating? Yeah, it's kind of frustrating, but I think we're seeing a lot more movement. And I think when you see employers are looking at their renewals, they've already gone every rung of the ladder to narrow their networks and go to the HSAs, and they've got, $18,000 family out of pockets, and they still have a $3,000 premium. It's like, I think, yeah, we're kind of past that point now where they're going to challenge us, and we're ready. We're ready for the occasion. And I think, go ahead, Scott. Well, you're driving a wedge in the system, and it's phenomenal. And, my Christmas wish list is I'd like to see this happen in other surgical situations. We are starting to see a little bit, right? And so, yeah, I mean, the movement is out there, and the movement is strong, and it's only going to get stronger. But yeah, if you look at it, we're trying to bring the tangibility of healthcare, because there's so many things that go into it, and it's, loss of productivity I can't put on a spreadsheet, but, we want to just drive the experience for the member at the end of the day. And if they have a good experience, I mean, you can avoid a morale hazard. Everybody's here with that C-suite and the HR department. And that's really what it comes down to. Everybody is happy at the end of the day, right? Yeah.
Companies.
Yeah.
Yeah.
Neither of you were wrong. But yeah, I mean, there are a lot of forces against us, like you said, big health systems, large insurance carriers, but this alignment that we have through Ortho Forum Value Network, Free Market Medical Association, Health Rosetta. I mean, there are other groups out there that we're all, trying to, push back on these forces that are against us. And it's super awesome to see.